A colonoscopy is a medical procedure that lets your doctor look inside your colon and rectum for problems such as ulcers, inflammation, bleeding, polyps, and tumors. A colonoscope is the tool used to perform a colonoscopy. It is a thin, flexible tube with a light and video camera on the end. It is inserted through the anus into the rectum and is carefully guided up through the colon all the way to the cecum. The colonoscope can usually be used to enter the very end of the small bowel, known as the terminal ileum. The front tip of the colonoscope contains a video camera, which sends real-time images to a computer screen so that your doctor can examine the colon. The front tip also has a light, a channel for water irrigation, a channel for air and water, as well as an instrument channel. The irrigation channel is used to flush water or air into the colon to remove debris or stool and see more clearly what the inside of the colon looks like and to check for polyps. Special tools, such as tiny forceps or wired loops, snares, can be passed through the colonoscope to remove polyps and take samples, called a biopsy, of suspicious tissue to look for signs of cancer. A colonoscopy usually takes 30 to 60 minutes and is performed in a hospital or clinic by a trained doctor, known as a gastroenterologist. You will be offered a sedative to help you relax during your colonoscopy, and you will be placed on your side for the procedure. Your doctor will carefully insert the colonoscope into your rectum and advance it to the end of your colon, to your cecum. The colonoscope bends so your doctor can move it around the curves of your colon. Your doctor might gently press on your abdomen during the procedure or ask you to change positions occasionally to help move the scope through the colon. During the entire procedure, a magnified, high-definition video from the colonoscope plays on a monitor in real time so your doctor can thoroughly examine the lining of your colon. Video may be recorded, and photos are taken as well. A small amount of air may be blown into your colon to help expand the passageway so that your doctor can see better. This can make you feel pressure or mild cramping, but it can be eased by taking slow, deep breaths. The colonoscope is then slowly pulled out while your doctor carefully examines the inside of your bowel. If your doctor finds polyps or suspicious areas during the colonoscopy, the polyps will be removed, and small tissue samples will be taken to be checked for signs of cancer. Polyps are usually not cancerous, but they can change into cancer, which is why they need to be removed. Polyps are removed with biopsy tools or wire loops that are passed through the scope into the colon. The most common removal technique is called snare polypectomy, where the polyp is surrounded by a wire loop and then an electric current in the wire burns off the polyp. The polyp is then pulled through the instrument channel and collected for biopsy. Other methods are available depending on the size and shape of the polyp. Polyps contain no nerves, so you won't feel pain during their removal. After your colonoscopy, you will be taken to rest in a recovery room until the effects of your sedation wear off. You may feel some gas or cramping, but this will quickly pass. Because of the sedation used during the procedure, you will need a family member or a close friend to drive you home. You should take the rest of the day off and not make any major plans for 24 hours. Before you go home, your doctor will share the results of the colonoscopy with you. Now we'll uncover the 8 most common warning signs of colon cancer. Colon cancer is one of the most common cancers worldwide. While it often develops silently, there are warning signs your body may give you. Recognizing these signs early can make all the difference. When caught in its early stages, colon cancer is highly treatable, with survival rates dramatically increasing. In this script, we'll uncover the 8 most common warning signs of colon cancer. While these symptoms don't always mean cancer, they are your body's way of signaling that something isn't right and should be checked by a healthcare professional. One of the earliest and most common signs of colon cancer is a noticeable change in your bowel habits. This can include diarrhea that persists longer than usual, constipation that doesn't resolve with typical remedies, or a sudden change in the consistency or shape of your stool, such as narrower stools. These changes may indicate a blockage or narrowing in the colon caused by a tumor. While occasional bowel irregularities can happen due to diet or stress, persistent changes lasting more than a few weeks should be taken seriously. Seeing blood in your stool is always a red flag. It could appear as bright red streaks or darker, tar-like stools, known as melena, which indicate older blood. Blood in the stool is a potential sign of colon cancer, as tumors in the colon can bleed. It's important to note that blood in the stool can also result from conditions like hemorrhoids or anal fissures. However, you should never assume it's something minor. Only a healthcare provider can determine the cause. Persistent abdominal pain or cramping is another symptom to watch for. This discomfort may feel like bloating, gas, or a constant ache in your stomach area. As a tumor grows, it can obstruct the colon, leading to pain or cramping. If abdominal pain becomes frequent, severe, or doesn't resolve with typical treatments, it's essential to seek medical attention. Sudden, unintentional weight loss can be an alarming sign of colon cancer. Cancer cells consume a significant amount of your body's energy, and the disease can also interfere with your body's ability to absorb nutrients. This weight loss is often accompanied by a lack of appetite and fatigue. While there are many reasons for weight loss, experiencing it without changes to your diet or exercise routine signals that something might be wrong. Feeling constantly tired or weak can also be a sign of colon cancer. This isn't the kind of fatigue that a good night's sleep can fix. It's a deep, persistent exhaustion that doesn't go away. Colon cancer can cause anemia or low red blood cell count due to slow bleeding in the colon, depleting your body of oxygen-rich blood. Anemia can leave you feeling drained, lightheaded, and unable to focus. Do you feel like you still need to go to the bathroom even after just finishing a bowel movement? This sensation, known as tenesmus, can be caused by a tumor in the rectum or lower part of the colon. A tumor can obstruct the passage of stool, giving you the sensation of needing to go when your bowel is already empty. If this feeling becomes persistent, it's worth discussing with a doctor. Everyone experiences gas and bloating occasionally, but if these symptoms become chronic or unusually severe, they could indicate a deeper problem. Colon cancer can cause blockages in the digestive tract, leading to trapped gas, bloating, and a sense of fullness even after eating small amounts. If these symptoms don't improve or are accompanied by other signs like abdominal pain or changes in bowel habits, seek medical advice.